Okay, my name's Colin Frank. I am a PGY1 pharmacy practice resident with Ohio Northern University, so I'm still here at the campus. Today I'm going to talk to you about the dangers of self-treatment with over-the-counter medications. I can't take full credit for this presentation. We had a student last month who was with us who helped create this, Caitlin Nestle. So she put in a lot of the work. Unfortunately for them, rotations only last a month, so she couldn't be here to present it. Before I get started, I just want this to be a fair warning that I'm not trying to get you guys to stop taking over-the-counter medications. Over-the-counter medications are great. There's going to be a lot of scary terms in here that might scare people away from using over-the-counter medications. But as long as you're taking them as you should, then there should be no problems. So just some objectives on what we're going to go over. So first we're going to discuss how to read an over-the-counter label. I feel like a lot of patients just really skip over them really quickly. We're going to define self-treatment and the prevalence of self-care in the United States. Discuss various OTC medications, define OTC medications. Discuss the difference between misuse of OTC medications and abuse of medications. And then review the dangers of a couple of different drug classes that we commonly use over-the-counter medications. So if we're going to define basically what self-treatment is, so self-treatment is the act or the instance of applying medical therapy to oneself without medical supervision or prescription. So basically this means that you are getting an over-the-counter medication without the recommendation of a doctor or a pharmacist or a different healthcare professional. You're doing this on your own. So when you grab one of those products off the shelf, you really want to look at the label. Just out of curiosity, how many people in here use over-the-counters pretty frequently? So just about all of us. So how many of you really read the label? Or do you just grab the box because you know what it is and you've been taking it for years? Yeah, exactly. So we should do this every time we get one of these products. So I just kind of like to go through this list on the right. So first is looking at active ingredients. So there should be in the box that says active ingredients, and this really tells us 3 pieces of information. What product's in it, how much of that product is there, and then what's its purpose? Why are we actually taking this medication? Next, you should look at uses. If you're taking a product and it's not listed as a use, maybe it's not the right product. At that point, you kind of want to stop, ask the pharmacist, say, hey, this is why I'm taking this product. Is this product even right for me? Should I be taking something else? Next, you want to go down to warnings. And warnings are just kind of like a checklist. You go through until you hit one, and then you have to hold up, stop, and talk to your doctor. So in this scenario, it's if a patient has glaucoma, they shouldn't take this medication. So if you had glaucoma, that would be like a stop. I need to ask further questions. Also in the warnings, it's also what to expect. It's always nice to know what you're going to expect. So with this medication, it's an antihistamine. You're going to expect to be drowsy. And then they give you a little bit of extra direction. So don't take this with alcohol, just to kind of help with the drowsiness. Also, don't operate a motor vehicle until you know how it affects you. So these are really important tips that they're giving you that you might just skip over if you're not reading the warning section. Also in the warnings is generally if it's okay to take while you're pregnant or breastfeeding. Might be important to some people. Also keep out of the reach of children. It's generally a good rule for all of your medications, but it should be on there on your medications. Next is direction. So this is when should I take it? How often? How much? What's the max? This is generally what people read, and it's just this box and none of the others. So this one people do a pretty good job at, but as long as you stick to those directions, you're probably going to take the product fairly safely. Next, going on to the last 2 boxes. So there's other information, so sometimes they'll tell you how to store it, making sure that you get the longest shelf life for this product. And then there's one more box that's pretty important that a lot of people just skip over, and that's inactive ingredients. So a lot of people have allergies and sensitivities to a lot of different things. A very common one is dye allergies. So if you're using this medication, you might skip over this box, but it clearly says that it has a yellow number 10, which is a dye. So that might irritate someone who has a dye allergy. Additionally, it has lactose in it. So if you're lactose intolerant and you took this medication, then you'd have GI side effects, or stomach side effects. So it's really important to read the whole label when you get these products. Just going over some facts with over-the-counter medications. So there's over 300,000 different products available over the counter. So a lot of different products for a lot of different uses. 81% of adults use OTC medicines as a first response to a minor ailment. So if there's a minor problem, the first thing they're going to do is go to an OTC medication. I am one of those 81%. So it's not like this is a bad thing. An estimated 3 out of 4 people routinely self-medicate. So this is going a little bit further. This might not just be a minor problem. They're going to use these medications without seeing a doctor. These are, however, a good thing. OTC medications are relatively available. They're relatively cheap. You're not going to be able to go to a doctor for every single little problem that you have. So OTCs are a really great option when needed. So on average, U.S. households spend about $338 per year on over-the-counter medications. And on average, each one of those dollars spent saves the U.S. health system $6 to $7. So OTC medications add up to a healthcare savings of $102 billion each year in the U.S. So these are good products, both so that we can take care of minor problems and also to our healthcare system. It's a huge cost savings. So what is an over-the-counter medication? So sometimes these are referred to as non-prescription, commonly abbreviated OTC. So they're available on request, so you don't need a prescription for these medications. Generally, they're kept over the counter, so not behind the pharmacy counter. And generally, these medications have a greater margin of safety than prescription medications. However, the point of this presentation is to show you that they're not 100% safe. They're generally safe, but there are ways that these are misused, abused, or just used in patients that they shouldn't be. So that's really what we're going to go into. So just defining these two terms. So we're going to talk about what misuse is and then compare it to abuse. So misuse is defined as using an OTC product. You're using it for a real problem. So I might be taking a pain medication like Tylenol because I have pain, but I might be using a higher dose or using it longer than recommended. So I don't know how many people in this room have ever used Tylenol and just taken a few. They haven't really counted or they don't know how much they really took. I've done that before. This is an example of misuse. When you continuously misuse products, that's when you start to go to abuse. So abuse is a non-medical use of an OTC product. So just some examples of this is there are some products out there that can cause a euphoric effect or a high. And there's a couple of OTC products that can be used to help you lose weight when they're not meant to help with losing weight. So you're using these products not because you're using them for a legitimate medical use, but because you like the way it makes you feel or you like a certain side effect that it has. Eventually, as you continue to abuse these, then they can become habit forming. At that point, you're not only just using these once in a while, these are things that you have to do. So some of these that can become habit forming are decongestants, laxatives, antihistamines, sleep aids, antacids. We'll go through this list as we go through the presentation. So a really common use for OTC medications are pain medications. So I've used all three of these. I'm sure a lot of you guys have before as well, but we'll go through each one. So acetaminophen, really important is that it's occasionally abbreviated APAP. So if you ever see APAP on a package, that means it has acetaminophen. This is commonly used for pain, fever, headaches. Works really well. I use acetaminophen all the time. Generally, we want to see this used in patients older than 12. There is a children's dose that you can use greater than 2 years of age, but if you're using it over the counter, generally 12 and up. There is a max dose of 3,000 milligrams per day, and this is really important. This is where a lot of people don't follow this and misuse this medication. So it's mainly, it's processed in our bodies in our liver. When we go over that 3,000 milligram limit, we're placing a lot of stress on our liver and it's causing damage. If you do a really high dose, you can cause liver failure. So this medication is dangerous. It's not 100% safe if you go over that 3,000 milligram limit. A lot of products contain this. I'm sure that picture on the right is really tiny, but it's 20 different products that contain acetaminophen, where you might be taking multiple of those products and getting more acetaminophen than what you're realizing. There's a lot of prescription medications that also have acetaminophen in it, so it's really important to make sure you're not taking more than one product with acetaminophen, therefore you're not going over that 3,000 milligram dose. Like I said, there's a lot of different dosage forms, and you shouldn't take this with alcohol. Alcohol is rough on your liver. If you take them together, it's going to be really rough on your liver. So going into, if you've had too much of this, what are some of the signs and symptoms? So if you continuously go over that 3,000 milligram limit, you might notice starting to have abdominal pain, nausea and vomiting, not feeling hungry or fatigue. These are all signs that your liver is taking damage. Eventually you'll get what's called jaundice, and that's what the picture on the right is. At this point your liver is not functioning how it should be, and you can't clear different products from your body. It actually causes your skin to yellow, and that's what jaundice is. It's yellowed skin. So it's really noticeable in the eyes and the mucosa, so on the lips, places like that. The next pain medications that we go into are the non-steroidal anti-inflammatory drugs, or NSAIDs. These also are used for pain, and they also help with inflammation. So, any sort of muscle injury, anything like that, NSAIDs are really helpful. These are also metabolized by your liver, so we're clearing it through the liver. These two can be found in a lot of cold and flu preparations. Like I said, when you have the cold and flu, you get achy, so these help with that. These are not recommended to be taken daily, and I'll go into a list of reasons why, but if you continue to take NSAIDs long term, that's when you start to do some damage to your body. The one exception I want to make is baby aspirin. So aspirin is an NSAID. This is fine to take daily as long as you're doing a lower dose, so 81 milligrams or 325 milligrams a day. I don't want to have people stop taking their daily aspirin. That's good for your heart, especially if your physician told you to. So as we continue to take NSAIDs, basically what happens is NSAIDs cause your body to retain fluid, and that increased fluid makes your heart work that much harder. And so it increases your blood pressure. And that increased blood pressure can then lead to vascular damage, so damage to your heart, or to the blood vessels in your brain, so you could have a heart attack or stroke. It also damages the vessels in your kidney. So you're going to cause heart damage, damage to the vessels in your brain, and kidney damage if you continue to take NSAIDs and it causes your blood pressure to go high. It also increases your risk of bleeding. So NSAIDs stop our clotting system. So it increases your risk for ulcers. So a lot of patients who take NSAIDs for a really long time or at really high doses will actually get stomach bleeds. And then also patients who take warfarin. Warfarin is a very common drug in elderly patients. Helps prevent your body from clots, so it helps stop strokes or heart attacks. If you take NSAIDs with warfarin, then you're going to increase your risk of bleeding. So this is just a little table going through the 3 different products. So over the counter, generally you have ibuprofen, which is 200 milligrams, so Advil or Motrin. Naproxen, which is a 220 milligram tablet, and that's Aleve. Or aspirin. Aspirin's been has been out for so long, that really doesn't have a brand name, but if you were to associate it with a brand, it'd be Bayer. If you look at the instructions on these products, it'll give you a dosing. So it'll say 1 to 2 tablets every 4 to 6 hours as needed. You could follow that and use 2 tablets every 4 hours and take 12 tablets, which is actually double the max dose. So it's very important that you follow both the dosing and max dose. So you could take 1 tablet every 4 hours and have a max of 6 tablets, but you shouldn't take 2 tablets every 4 hours because then you're going to go way too high. So it's just really important to stay under that max. That's really going to keep you protected, not having a lot of these symptoms. Aspirin's a little interesting. We don't want to use aspirin in teenagers or younger. Aspirin has a chance to cause what's called the Rise syndrome. It's a really rare condition. It happens in children who have been exposed to a virus and then exposed to aspirin. It's very serious when it happens. It leads to nausea and vomiting, and eventually it'll lead to seizures, coma, and potentially death. So as a pharmacist, I don't recommend aspirin to anyone under the age of 18. If that were to happen, this would be a very serious situation. That would be need emergency treatment. So just some tips on how to use these safely. Always check the ingredient, so don't double up on acetaminophen. Don't exceed those maximum doses. Just generally follow directions on the package, and don't use these medications longer than 10 days. If you're still having pain after 10 days, something's going on and you need to see a physician. Similarly, if you're using this for fever, greater than 3 days, there's probably some sort of infection or something going on that you need to see a doctor. You can't just be treating these by yourself. So the next group that we'll go into is cough and cold medications. We're kind of passing the cold season now, so probably would have been a little helpful earlier on, but we'll still go through them. So the first ones that we go through are decongestants. So this is kind of the first OTC that we really became concerned about with abuse. So this isn't a commonly misused medication, but a really abused medication. That's pseudoephedrine or Sudafed. So Sudafed in large doses can be turned into methamphetamine, which is a street drug that's very addictive. Because of that, you can't get this from a pharmacy necessarily over the counter. It would generally be kept behind the counter, but you can still get it without a prescription. However, you can only get very small amounts of it at a time. That way that this medication isn't being abused. Another good case with this is you may be using this medication perfectly fine according to labeling, but it might not be safe for you. So one of the issues with pseudoephedrine is that it increases your blood pressure. So if you're a person who has high blood pressure, you shouldn't be taking Sudafed. Additionally, it causes dizziness. So if you're an older patient and you have a prone risk of falling, this is a bad medication for you. You're following the directions perfectly, but it's still not safe. A safer alternative that they came out with is phenylephrine. This is widely available in a lot of cold and cough products that you can find over the counter. Has a lower abuse potential. It can't be turned into methamphetamine, but it still causes an elevated blood pressure. So once again, if you have high blood pressure, this medication probably isn't the best for you. Going into some cough preparations, so there's really two here. So this is the newest OTC that's really starting to, patients are starting to abuse it. So dextromethorphan, it helps you to, it stops you from coughing. So it's found in a lot of those medications. If taken in large doses, it's pretty dangerous. It does have addictive properties and is often abused. In really high doses, you'll get dizziness, hallucination. Eventually, if you get too high of a dose, it can lead to coma and death. So it is serious if you know someone or suspect someone of abusing this medication. It has some pretty nasty side effects. So the abuse of this medication is called robotripping. So the brand name of dextromethorphan is Robitussin, so that's where this name comes from. Basically, they're just taking a lot of this medication, and that's giving them this euphoric effect. It's not just in Robitussin, however, it is in a lot of different products. So you can get this in Vicks, NyQuil, Dimetapp. Basically, if you notice that you had a lot of this medication and then it's gone, there's some sort of abuse going on, you should be concerned about that. So how does this actually work? So in really high quantities, it actually affects the brain similar to PCP or ketamine. Not very common street drugs anymore, but they used to be. So it produces this really sensation of euphoria, and when they continuously do this, this leads to an addiction. They're addicted to that really great feeling or euphoria, and they can't stop. Eventually, this causes a lot of damage. So it'll cause impaired motor function, so they won't be able to function properly, increased heart rate and blood pressure, so once again, really dangerous with causing heart attack and stroke. Eventually, at really high doses, you can get extreme agitation, increased body temperature, and those have some very serious side effects or consequences. The thing to know with this is that dextromethorphan products often have acetaminophen. So when they're taking an entire bottle of this product, they're getting extremely large doses of acetaminophen, and patients abusing this medication also have liver toxicity or liver failure. So kind of a safer alternative, guafenicin acts a little differently. It really doesn't help you to stop coughing, it just makes it easier to cough up whatever's causing that chest congestion. So it thins out the mucus and basically allows you to bring it up. Adverse reactions with this are pretty minimal, so you might get a little bit of drowsiness or dizziness. In large doses, it causes vomiting and nausea. So products with both guafenicin and dextromethorphan, the guafenicin actually acts as an anti-abusive. So it makes it so that they can't chug that bottle because they'll actually vomit. If you're still noticing that your symptoms are persisting after 7 days, you shouldn't continue to use this. Once again, something else is going on. You either have an infection or the flu or something going on that you need to see your physician. So going into our last category of cough and cold preparations are antihistamines. And these are just some common ones. So Benadryl, Allegra, Zyrtec, Claritin. These are pretty common medications. So they're often in cold and cough products, and that's because when your body is exposed to an allergen, your body releases histamine, and histamine causes all of the symptoms that you think of with allergies. So it causes your eyes to become watery, your nose starts to run, you might get congested, those sort of things. So when we throw in an antihistamine, we're blocking those things. So there is a little bit of abuse with antihistamines, not as much. There's a sedative effect to it. Basically, I'd compare it to if you drink a lot of alcohol, so it's basically like you feel like you're drunk. And then this effect is increased whenever it's combined with alcohol or another sedating medication. So there is an abuse potential with this medication. However, if you're following the directions, just taking one a day, you won't have this issue. So side effects, like I said, common drowsiness and dry mouth with just using it regularly. If you do high doses, you start to see those same things. So some hallucinations, psychosis, eventually seizures and coma. So these can be very serious in high doses. Moving on. So another commonly misused medication are nasal sprays. How many, just out of curiosity, how many people in this room have used nasal sprays recently? Anyone? Yeah. So these are actually really commonly misused, not because there's any sort of abuse with them, but just because they're not following the directions or they don't know about the directions. So Afrin and Zicam are pretty common over-the-counter nasal sprays to help with congestion. So basically how these work are they constrict the blood vessels in your nose, and that stops you from producing mucus. So it helps with congestion. However, they're only meant to be used for 3 days. 3 days or less. Anything over 3 days will lead to what's called rebound congestion. So basically your body becomes resistant to the medication. You need more and more in order to create that constricting effect. And then when it wears off, your body actually has an opposite effect. It actually creates more mucus and you get worse congestion than when you even started. So it's really important with these medications to only limit it to 3 days. That way you won't get this rebound congestion. Just some side effects of nasal sprays. So short-term use, you might, it's been shown to have mouth breathing, so you'll start to breathe through your mouth, and that can irritate your throat. Long-term use, so once you go over 3 days, then you can actually start to get some scarring on the inside of your nose. So that's some permanent damage. Also, you can get irritation. Nosebleeds become more frequent, more severe, that sort of thing. Rarely you can get erosion, so you can actually get sores on the inside of your nose from using these products long-term. And then the last category that's commonly abused, because who wouldn't want to weigh less, right? So people will figure out how to use these medications to lose weight. We really have two different drugs that I'm going to talk about. So stimulant laxatives, so Senna and Bisacodyl, or Senecot or Duplex. Basically these work by irritating your gut, and then basically your body forces out whatever's irritating it. So this is meant to be used in patients who are constipated, they really can't go, they really need relief. They need it fairly quickly, so it generally works between 6 and 10 hours. This is often abused, especially in patients with anorexia or bulimia. So basically you're forcing your body to get rid of it, it's causing weight loss, you're losing a lot of water, a lot of electrolytes. And this is really dangerous. Generally when you lose a lot of electrolytes or you become really dehydrated, you need to have those electrolytes and that hydration, so a lot of times this will land you a trip to the ER. Also, if you do this long term, you'll actually lose muscle strength in your intestines because your body no longer has to work. This medication is doing it for it. So these can be dangerous used long term. Also, there are a whole lot of OTC products that claim that they're going to help you lose weight. There used to be a really common one called ephedra, which was combined with caffeine, and it was meant to make you lose weight, basically by ramping up your metabolism. So your heart was working harder, it was increasing your heart rate, increasing your blood pressure. And that actually led to quite a few heart attacks, strokes, and seizures in these patients. So this was actually pulled from the market in 2004. Manufacturers still wanted to make that money from selling these weight loss medications, so they just switched it with bitter orange. And bitter orange contains synephrine, which is very similar to ephedra. So basically what I'm trying to get from this is they're always going to try to substitute something into these products, and they're going to work the same way. They're going to increase the work on your heart. These products really aren't safe. I would never recommend one of these weight loss products to a patient. But once again, this is one that you could use properly, but it's not safe. So it's always important to know what you're taking. The last is herbals. Does anyone in here use an herbal product? They're pretty common. So it's always important to know exactly what your herbal product is and what it does. A lot of medications that we use, so a lot of prescriptions, interact with these herbal products. I'm going to keep on jumping back to it, but Coumadin is a very important drug, and I work with it a lot. There's a lot of herbal products that interact with Coumadin. So St. John's wort is a very common over-the-counter medication. It helps with depression, it helps with your mood, those sorts of things. If patients want to use it, that's great, but it also interferes with Coumadin. So if they use that medication without talking to their doctor and letting them know that they're going to start these medications, then their chance of bleeding might be really, really high. So it's always important that if you're taking medications and you want to start an herbal product, because I don't want to scare people away from herbal products. They do some great things and they're over the counter and people can use them. Just make sure to contact your physician or pharmacist. Make sure there's not an interaction with what medications you're taking currently. So just to kind of summarize this whole presentation, I don't want to scare you away from OTCs or herbal products or anything like that. These medications are generally safe as long as you're using them properly. Everything should be fine, and they're actually very helpful. So as long as you know why you're taking it and know what you're taking, knowing the effects, so knowing those side effects, what to expect, reading and really paying attention to the warnings and cautions. These products aren't perfectly safe, especially if you have a conflicting condition with one of the wordings on these products. Don't use anything longer than 1 or 2 weeks. If you're having something that's not going right and you're using these medications to correct it and it's not working, you really need to see a physician. Be particularly cautious if you are taking a prescription medication, just making sure that nothing interacts with what you're currently taking. If you don't need it, don't use it. So there are, like with the weight loss medications, there are ways to naturally lose weight. You don't need those products. I would never recommend using this. If you have any questions, ask a pharmacist. I know this is going to sound corny, me being a pharmacist, but every pharmacy has a pharmacist. They're a great tool. We're really just there to help inform you on what you're taking. So that's my presentation. I hope you guys learned a little something about, at least when you get an OTC, what to do, what's really important, and what's out there. Do you have any questions I can answer? Yes?
I have a friend who does a liver cleanse once a month, and she just swears that that has helped her cholesterol and everything. What's in there, and what does it do to your liver?
I'm not completely familiar with what's in those liver cleanses. I don't know if there's been any benefit to doing a cleanse for your liver. I can't say that it's actually doing anything. It's probably not harmful though. So if she believes it's working and she thinks that that's really helping her health, she can go ahead and do that. Really what it's doing is it's helping clear your GI tract. So